Normal bladder function is simple in fact. The bladder has to store urine at an appropriate point. When your brain tells your bladder to empty, you need to urinate easily and completely. We know that it's related to differences in the sensitivities and behaviors of the nerves in the bladder and the muscles in the bladder. As the bladder gets full, there's sensory nerves in the bladder will begin to tell your brain that it's time to urinate. And that will happen in degrees. And anyone who waits long enough with a very, very full bladder can have urgency. This is not necessarily a problem. With an overactive bladder, the set point at which the sensory nerves start to say, you have to go, reduces and becomes unpredictable. The bladder will suddenly send a signal that you have to go right away, as if your bladder is completely full, and an ounce or two comes out. The sensation of urgency was completely out of proportion to what was actually in your bladder. There are 4 basic symptoms associated with OAB. The root is always urgency, which can cause frequency, nighttime voiding, and if it can't be controlled, urge incontinence. So urgency, frequency, nocturia or nighttime voiding, and urge incontinence are all symptoms of overactive bladder. Treatment options for overactive bladder always starts with bladder diary and behavior modification. It can also include pelvic floor physical therapy, medications, and surgery. Overactive bladder with or without urgency incontinence needs to be evaluated and treated earlier rather than later. You're not helping yourself by waiting. You're simply making yourself resistant to more and more therapeutic options.